Much of what we're doing in improving education, in reducing energy costs, in keeping taxes low, in helping businesses create new jobs, is building the foundation for continued economic advantage for New Hampshire. That's why we must also address health care costs. New Hampshire is one of the healthiest states in the nation, and we have one of the highest percentages of residents with health insurance. But along with the rest of New England, we have among the highest health care costs in the nation. These costs are making it harder for our companies to grow and harder for our people to afford health care. We have shared goals in New Hampshire: lower health care costs, better health care quality, and more insured citizens. Washington is working to meet those same goals. But as I have made clear, Congress must reject any bill that piles unreasonable new costs on the states or hands out special deals to individual states. Every state Every state should be treated fairly. Here in New Hampshire, we aren't waiting for Washington to act. We're changing our health care system now. Small businesses need access to a more affordable health care option. So we created a new, less expensive, prevention-focused alternative, New Hampshire Health First. Consumers need better and more transparent information to make smart decisions. So we've put cost and outcome comparisons between hospitals online. Technology can help control healthcare costs and improve patient safety. So we've worked to ensure that nearly all of our healthcare providers can now prescribe medications electronically. Our goal should be ensuring that New Hampshire is in the top 5 of all states in terms of healthcare outcomes and in the lowest 5 in terms of costs. The current financial rewards in our healthcare system are backwards. We should be creating incentives for better results and lower costs. We don't do that. Instead, the incentives are for the healthcare providers to purchase the most expensive equipment, use it as frequently as possible, and to compete with each other for increased market share. The direct result is higher costs. Study after study demonstrates that higher costs do not translate into better care. In fact, some of the best results come from healthcare systems with the lowest costs. We must be smarter in how we use our healthcare dollars here in New Hampshire. To lower costs and improve their health, all patients should have a medical home where a primary care doctor coordinates their care. But if the healthcare system's current focus on paying by the service, it makes it difficult for doctors to spend time managing the care of their patients. That's why, in cooperation with the major insurance companies, we've launched 9 medical home pilot projects across the state, where doctors are reimbursed for coordinating care. These pilot projects are demonstrating that we can make it financially possible for providers to focus on what's best for their patients. We need to expand that model across our state and make sure that our healthcare dollars are paying for results and not just procedures. That's why the Citizens Health Initiative is developing a pilot project to encourage our hospitals and provider groups to transform into accountable care organizations. Accountable care organizations would take what we're learning from our medical home pilot and expand it across health networks. Under this model, a healthcare system is given a budget for serving its entire community, and it then coordinates care across its entire system, focusing on prevention and focusing on improving outcomes. Providers and the healthcare system profit from providing good, cost-effective care. We're not spending our healthcare dollars the right way, and it's time for that to change. We must all stand up, employers, citizens, and state government, and say that we are not going to tolerate the old way of doing business. We must demand change from the insurance companies and from the healthcare providers. We can and we will have better, more affordable health care in New Hampshire.